So colorectal cancer really describes two different things, colon cancer and rectal cancer. Oftentimes they're bundled together because the symptoms are similar. The evaluation method, such as a colonoscopy, is often similar, and the treatment is also somewhat similar as well. Cancer as a whole is when you have a growth in the body that starts to invade tissues. In this case, colon or rectal cancer involves a mass or growth inside your colon or rectum that begins to invade into the tissues. Polyps just define little growths that form inside the colon. Most of the time, these are typically going to be precancerous polyps. In other words, if you leave them there, they'll keep growing, and eventually they can become cancer, which is why we take them out when we see them during a colonoscopy. A colonoscopy is very important because colorectal cancer is very common. Not only is it the third most common cancer diagnosis in men and women, it's also the third most common cancer-related death in men and women. That's why it's important to screen early, to try to catch polyps early before they get a chance to grow. There are a few other options other than colonoscopy to get screened, but they have their limitations. You can do a fecal occult blood testing where they check for microscopic amounts of blood in your stool. You can do a partial colonoscopy, which is called a sigmoidoscopy, but none of them will evaluate your colon as well as a colonoscopy, which is why a colonoscopy is the gold standard for diagnosing and detecting colon cancer. Most people are worried about a colonoscopy is going to hurt or that they'll remember it. The fact is that most people don't remember any part of it, and most people come out of it without any pain or any symptoms. Everyone is technically at risk for colorectal cancer. That's why it's the third most common cancer in both men and women. That's exactly why we screen everyone starting at 50 years old and even younger in those that are higher risk. Those that are deemed higher risk for colorectal cancer are typically those that have a family history of colorectal cancer, those that have a history of colon pathology such as inflammatory bowel disease, or in those that have any worrisome signs or symptoms such as abdominal pain, bleeding, unexplained weight loss, or change in bowel habits. Colorectal cancer is said to be one of the most preventable cancers because early detection is possible thanks to colonoscopies. For an average risk individual, colonoscopy is done every 10 years. Now, your risk is based on your risk factors, which your primary care provider or your physician will go over with you. If you want to schedule a colonoscopy, you need to contact your primary care provider, who will then refer you to an endoscopist.